Get ready to say goodbye to pelvic pain forever with pelvic floor physical therapy. It's a game changer. Have you ever suffered with pelvic pain or pain down there and wondered what it was you could do about it? Maybe you looked up other videos and you found out about pelvic floor physical therapy, but you didn't know exactly who it's for or what it involves. Well, then you're in luck, because that's what we're going to discuss today. Not only what is the pelvic floor and what does it do, but we're going to discuss what an evaluation would look like, at least in my clinic. Now, I will admit that pelvic floor physical therapy can vary from location to location, but this will give you a couple things to look out for and perhaps questions to ask as you're researching pelvic floor physical therapy. The pelvic floor is a critical aspect of the body because it sits at the base of the abdominal cavity. So your abdominal cavity is kind of a can, that's what we call it, and the pelvic floor sits at the base, so that's the bottom. The diaphragm, or the breathing muscle, sits at the top of that. You've got your abdominals in the front and the low back muscles in the back. And all of these function together. And if they're not functioning together, somebody's going to be in dysfunction. And this is going to be really important as we talk about what the evaluation looks like. Now, the pelvic floor specifically is a group of muscles. Now, they're not big muscles like your biceps or your quadriceps. They're thin muscles. They're like sheets. But when they're in dysfunction, they can cause a lot of problems. Now, the pelvic floor has 4 primary functions. One is to support the organs in the abdominal cavity, particularly your uterus and your bladder. 2, it's going to stabilize the pelvis and the spine. And this becomes important during the evaluation because we need to look at your pelvis and your spine to make sure that they're not in dysfunction and causing increased stress to the pelvic floor. 3, it assists with sexual function. And if you have had pain with intimacy, you know how important this is. And 4, it supports bowel and bladder control. So if your pelvic floor is dysfunctional, you may be struggling with leakage when you're running, coughing, laughing, sneezing, all of those types of things. That would be a pelvic floor dysfunction. Now, I want to take a little side note here and say if you are not able to maintain urinary or bowel control at all, that is a totally different issue. That's a symptom of cauda equina, and that is a very serious medical condition. So if you cannot maintain bowel or bladder function at all, no matter what you do, I want you to go look that up and make sure you seek medical attention immediately. Now, if your symptoms are more difficulty controlling your urine while you're laughing, coughing, sneezing, running, jumping, all of those things, then you're in the right place. So the pelvic floor has a lot of functions and it has a lot of friends that it works with. And that's why during the evaluation, we want to look not only at the pelvic floor, but how everybody nearby is moving as well. Now, I will say that a pelvic floor evaluation will look a lot different potentially from clinic to clinic. There are some pelvic floor physical therapy clinics that only treat the pelvic floor and maybe will treat the hips too. In my clinic, we're going to do a full evaluation basically from head to toe to see how the pelvic floor dysfunction is affecting the rest of your body, or if there's dysfunction in other areas of your body that are affecting your pelvic floor. Let me explain. We're going to start the evaluation by watching how you're moving. So we're going to watch how you're walking and see if your body has created any compensatory patterns, see if we see anything that's really abnormal that may be putting an unusual amount of stress on your pelvic floor. Next, we're going to look at how the joints are moving more specifically. So definitely your low back, your pelvis, your hips we want to see, but depending on what we find during there, we may need to even branch out. So we may need to see your thoracic spine or your upper back. We may even need to look at how your neck and shoulders are moving. If we see some dysfunction in the hips, we may need to look more specifically at the feet and knees if we think that that may be the cause of your hip dysfunction. So at this point, we may branch out a little bit depending on what we've seen so far. The goal is that at the end of the evaluation, we want to know exactly what muscles and tissues are in lesion and how these compensatory patterns have developed so we can come up with that plan of care. So every evaluation is a little bit different, but we're definitely going to be looking at how the low back and pelvis moves for sure. And of course, we have to look at the strength of the muscles. We may look at them as a group just to see how everybody's working together. We may do some more specific muscle testing to see if specific muscles are in lesion. And of course, we want to check out the pelvic floor muscles. Now, this is not like a yearly exam type of situation. For me in my clinic, I have patients start in side lying so we can assess the posterior pelvic floor. Then we'll have you lay supine so we can assess the anterior pelvic floor. I don't necessarily do an internal exam on the first visit. It really depends on patient's tolerance and how tight things are. We don't want to be causing pain during the evaluation. I always tell my patients, you're in control. You get to decide exactly how much movement you feel comfortable with and exactly what feels safe for you, because we don't want to be causing pain during the evaluation. That's definitely not our goal. So for some patients, I am able to get an internal examination in, and for some, I'm not, because things are just too tight and it's going to be painful. So there's no point in doing that. We understand what is today. I always tell my patients, we're trying to figure out what is so that we can create that plan of care. So once we finish the evaluation, we know what is. We know how the pelvic floor tone is, and I will tell you that most of the time it's tight, and it's not so much a problem of weakness as tension. And the pelvic floor muscles cannot actually function efficiently. It's important to do a full evaluation of the body to understand what tissues are putting increased stress on the pelvic floor, as well as any compensatory patterns that have developed. So many women who come to see me with pelvic floor dysfunction have hip problems or SI joint problems or low back problems that have actually led to this pelvic floor dysfunction. Although that's what brought them into the clinic, that's not actually where their symptoms started. So our full plan of care needs to involve treating those other issues to take stress off the pelvic floor, because the pelvic floor can't heal if it has that increased stress on it. And that's how we finish up the evaluation. We're going to talk through all the findings, explain to you exactly what's going on, why your pelvic floor is dysfunctional, what compensatory patterns have developed, and what the plan is to get you to your goals. Now, I will say sometimes patients really want to know exactly what the steps are from visit to visit. And this can be a little bit tricky because everybody's different. So although after the evaluation, I will have a very clear plan moving forward, at each appointment, we need to discuss how you responded to the last treatment session. Because no matter the response that your body had, it's going to be important to understand it, to know how to move forward. And that is one thing I would definitely recommend when you're looking for a pelvic floor physical therapist, is that the beginning of the session should always start with a discussion of how did you respond to the last session and what have you noticed since then. So usually as you're working through pelvic floor dysfunction, you'll start to notice some other things along the way. And it's really important to have that conversation of what are you noticing, what's changed, and how are things functioning. Now, how do you know if you need pelvic floor dysfunction? Well, there can be a lot of different signs, but primarily people will notice pain in their pelvic floor, either with or without intimacy, urinary leakage during running, laughing, coughing, sneezing, or a prolapse or a bulge in their pelvic floor, which they usually notice when they're washing themselves in the shower or in the bath. If that's you, I would definitely recommend seeking out help from a pelvic floor physical therapist. And I hope that this video has helped you know what to look for and what questions to ask along your journey. What questions do you have after watching this video? Definitely drop a comment below. I'd be happy to make a video to answer your specific questions. And if you're suffering with pelvic floor dysfunction, I'm going to recommend you download my free ebook, How to Stop Peeing When You Laugh, so that you can get my favorite exercise to do instead of Kegel exercises.